Monoclonal antibodies are most often used for what type of clinical indications? Option A. Cancer. Option B. Correcting congenital deficiencies. Option C. Replacement therapy. Option D. Psychiatric disorders. Option E. None of the above. The correct answer is option A. Monoclonal antibodies bind to unique epitopes on specific antigens, which either act as an antagonist to the antigen or employ the immune system to elicit an immune response against the target. Congenital defects in the immune system would result in an overall lack of antibody defense instead of lacking a single antibody type. Thank you for watching video. Please subscribe channel and like video. Please click on bell icon in order to get notifications for upcoming videos. Feel free to share videos and channel links.